Augustine. Thank you for joining us, Senator.
Good morning, Senator.
Morning, Chris. Morning, Sabrina. How you folks doing?
We're doing pretty
Great
good.
interview with Dr. Uggan. That was good.
Yeah, glad you didn't mind holding for that because I know we had you on
No,
earlier.
no, I enjoyed that. That was good information, and it's just amazing how they're trying to survive, and they could have been in better shoes right now, even before this budget came up.
And I think that's, I mean, it kind of is highly relevant that we're now entertaining this substitute budget bill. I guess we'll just start. Were you surprised with the veto?
What was that, Chris? Can you repeat that, please?
Were you surprised with the veto? I mean, the kind of like when you saw those messages that were coming out in the beautiful, nice-looking graphics posted on social media from Adelup. I mean, that probably was a hint that that budget was like out the door.
Yep.
I can understand that, but we did a comparison of her bill versus our bill that we passed. And at the same token, I don't know if you've seen the Office of the Inspector General's report in reference to the CARES Act.
There's a report out.
Well, there is a report out. As a matter of fact, I can even send you a copy.
Yes, please do.
I'll give you a very short comment about it, and just I'm looking at it, and it was as of August 24th. And it says here that, some of us senators, we discussed it. Guam received 117. We all know that. For public health, they gave 10 million to public health. That's what the governor did. And then going across economic, 14 million, 336,000 for medical expenses. CARES Act is focused towards COVID. If the governor is going to say, and on the report it says they've only total cost incurred is 24.7%. So if the governor's going to say that we need to do better, it begins with her. It begins with her on the CARES Act. And when we talked about, remember, I kicked out that first comment about the surplus fund from 2019. We put it in the budget to give GMH 10 million to help on their CIP. I heard Dr. Jolene ask for that. Ask for their CIP, give them their budget. We would not hesitate to give public health and GMH everything we could give them. But if it's not there, we can't give them. But it's there in the CARES. And that's what really bothers us is that, if we're saying as of August 24th, 24.7% is as total cost incurred. Well, I'm not going to say that they didn't encumber anything at the governor's office, but what else is there? What else is left? Because we haven't received a report. I have to look this up on the webpage of the Office of the Inspector General to see this amount. And this is across the board, Chris and Sabrina. Sabrina, is that if you've got CARES, anything related to COVID, maybe frontliners, police department, fire department, everybody use it for what it's intended for. And then we see whatever general fund we have left, they can use it to back up what CARES couldn't cover. But to use general fund to cover what could be covered by CARES, it doesn't sit well with me. And then if we go back to the budget that she submitted, I'm looking at my phone, okay, as I'm trying to talk to you folks about it, is that when we look at it, they want to move money to Department of Administration and Revenue and Tax. Great, but if it's all related to COVID, then give them CARES money. Give them what they got. And then they have public health here. They said they wanted to move money there, but in the bill it says allocate. The word allocate versus appropriate. Appropriate is very, very specific. This is where the money's going. Allocate is, well, we're going to anticipate, we're going to give them they need it, but otherwise we can use it somewhere else. That doesn't sit well with us. And then, as we went down the line, is that we need to understand that, number one, we projected the revenue base based on what we could conservatively believe could come in. Now, to say, no, we believe we can get 7 million more. Well, how about the CARES? What are we getting from CARES? Are we going to project for everything else while the people of Guam are suffering and going through all this when, remember, I just read a little bit about the Office of the Inspector General, Chris, and 24.7%. So 75% of the money is still not incurred. Cost has not been incurred. Well, maybe they encumber it. Okay, fine. Report. Tell the people of Guam what you've done with that money. Tell us so that we can figure out, and then let's take a look across the board on all GovCom agencies and say, well, we need to streamline somewhere. Well, why don't we take a look at on the administration side, which controls the effort to streamline, to say, maybe we need to start consolidating agencies. Maybe we need to find ways to reduce the cost and shift that funds to where it's needed, so that when we get on better footing, which is more money, then we can shift gears. Then they can do what they want, because they're in control of that. We're not in control of what they do in the streamline.
So
that was a good earful.
You're like
Yeah,
the
that
Dr.
was-
Uggen of the legislature this morning.
But I will send you guys the copy of that report.
who did the who did the report? OIG for
no.
Treasury or for who?
I think it's the Office of the Inspector General. That's from the states, from DOD or DOI. But I will send you. I'll send Jason a copy so you
Right
can
on.
post it and show it.
Yeah, he's got it.
Right. Yeah, because I know when we spoke with Edward Byrne last week, he was saying that only about 50 million of the 117 million in CARES Act funds was actually spent to date.
Yeah. Oh, we had a
So
comment
it's a
here.
lot.
So there's no
Well, if they say
transparency. There's
Go
a
ahead.
comment
Go
here,
ahead,
Senator.
Chris.
There's no transparency in the legislature between senators and the governor. Not surprised.
Yeah. So
There's
what?
no transparency between the governor and the legislature. Is that what you said, Chris?
Yeah.
Well, you know, I was very clear when I stated about what the Office of the Inspector General says, and if Mr. Byrne is saying they spend 50 million, okay, 50 million or 117, I think there's still 7 million there they could use for public health, and I think there's probably still some more money they can use for GMH. You know, GMH is hurting for doctors and nurses and all those folks. Use the CARES money for what it was intended for. Let's start with that. Let's use what we can use. Let's rebudget. They should rebudget what their priorities are on CARES and shift it towards what the intention was for COVID. Because everybody, all of us are all trying to do what we need to do to protect ourselves and to protect the community. But if there's money sitting, okay, 50 million. Well, simple math, right? 67 left? Come on, 7 million is there. Why do we need to change the budget to 7 million? And if right now the way it's tracking, if we keep going down the road, we're not going to have enough money. I mean, even DOE is asking for money for other areas, and we will want to give them. But how do you give money if you don't have money? And how can you project something where the projection is very slim? And if that don't come in, so then we go back into a deficit. We go into where they say, they kicked out all the news saying we can do better. Yeah, we can. Let's begin with CARES. Let's begin with that, and let's help GMH in the CARES issue. GMH, public health. How much true funding is DOE getting to help them so they can not use their budget for anything related to COVID to protect their students and their staff, and shift that for their other needs?
Yeah.
You know, there's a lot of.
Well, and I see too with the mass testing.
We're going to work it, and we're going to see what we can do today.
With the mass testing as well, Senator, it's like we have public health, they don't have the staff, they don't have this, but you're right. I mean, this money is sitting there and it's supposed to be used to help us fight COVID-19. So just what's really going on? Why aren't they using the money where it needs to be used?
Well, you know what, Chris? Senator Reeves was one of our leaders that said transparency. When we pushed the transparency, we got the first response about the CARES money, how much was budgeted and stuff like that. I keep asking my staff, have we got an update? Do we know where they're going and what they're doing? And all I've gotten was no update. What is so hard to update? And exactly what you said earlier, Chris, where's the transparency? If we're going to work as a team, then we got to work as a team. You know, TEAM, not TIM. You know, Chris, you got information.
Hey,
I have information, you need
there's
it, I'll
no
give it to
Lou
you.
in team.
I have no problem.
So yeah, I
Chris,
just wanted
are we
to,
good?
you keep talking about the CARES Act funding. I mean, you guys aren't planning on planning to legislate how this CARES Act funding is going to be spent in the upcoming budget session, are you?
No, we can legislate or
Right.
appropriate any of the CARES money. That's
Well,
all
you
the
can
government.
if you're Senator Amanda Shelton.
Chapow!
Ooh.
Ooh, burn, right?
I
Right,
mean,
Senator?
you can. She did.
No. Well, what she did, Sabrina, was she identified that care should be used first if available. That was the intent of her bill. I mean,
No,
if it was
I'm
possible for us,
aware.
if we could, we would put. I mean, we would have started first with the surplus, 35.6 million. That should have taken care of GMH 10 million. It should have. I honestly believe that. I understand we have payables, we have other deficit requirements, but we have a crisis in hand. We should have found ways to at least use maybe 50% of the 35. We would have taken care of Jimmy's. We would have the 10 million. They would have left 25 million left. We could have covered the 7 million. We could have given DOE. We could have taken care of what we need to take care of and not look for a projected funding. Not ask the people, go and shop. They don't have jobs. Right. People may lose their homes.
So it sounds like you guys were taken for a ride.
Again. I think they need to take the child lock off the
Because
vehicle.
I remember, Senator, you said when you guys were having your meetings, yeah, we were, we're talking, we're dialoguing, yeah, we're going to come up with this budget, we're working on the revenue projection, and boom, you had this surplus.
Yes.
Do you feel like you've been duped?
Yep. That sounds too mean, but I understand.
That's not mean. Let's be real here.
It is what it is.
I know where you're coming from, but I try to take it and just insist that number one, whatever funds we have available to federal, unfortunately surplus, I guess, is gone. But whatever federal money we have, we need to take the biggest bang for a dollar. The people of Guam are complaining, and they've been calling my office. They're calling every senator. They're calling everybody. Where are we at? What are we doing? And you know what? We only appropriate the money, and we only saw approximately the budget we passed $775, and to ask for $7 million more, it's we need to remind ourselves that, and the people of Guam saw that we were on virtual discussing the budget. We've also expressed there that we asked for their attendance, the administration. We didn't get their attendance other than specific directors and agency heads. And then now at the tail end, after we pass the budget, you're going to say, well, no, we could still see 7 million. Well, you should have participated throughout the event and keep expressing the existence of that projection and trying to convince as many senators as possible to increase. But after the first day, they basically bailed out. So then,
All right.
We've been duped.
Yeah, there you go.
Well,
So what's
real
gonna
quickly, real quickly though, I wanted to ask about your position on the GURA raises. The board approved the raises, given the fact,
raises,
even though it's federal funding, but the optics of it, as Senator Moylan has pointed out.
It's not good. The optics is not good, and I think the governor should be the one to step in there because that was a board they appointed, and the optics is not good. The timing is not right. I mean, nobody should be getting any pay raise. Nobody across the government of Guam or even in any government Guam related federal agency.
Even if they got high performance ratings?
I understand they did, but as the overseer for GURA, we found out about that when we read it on the news. Like, oh wow, they got a rating. Wow. I called and said, how did you get a rating? I says, well, the board decided. Okay, the board is appointed by the governor. Okay, then that's on the governor. The governor maybe should ask the board to seriously consider, holding back on that pay raise, even though they did implement it, and let them figure that out. Because if it was Gov Guam, we would on the legislature side, we would not be very, very pleased because it's wrong. Anywhere across the Gov Guam, there should be no pay raises. And many people have said, before you reduce anything, legislatures should reduce their salary. We already did that. We reduced our salary by what, 25, 30,000? Can't get any lower. We're getting paid less than mayors. And we're getting paid less than even directors. But we decide what goes on.
Definitely less than GURA's executive director.
You guys ain't deciding much nowadays because it's being decided for you. Senator, are you guys going to override this veto, or are you going to entertain the governor's nice substitute bill? Because if you're playing if you're playing tit for tat,
Chris, I'm not in support of a bill. I'm in support of an override. I'm hoping that the senators that did vote for the bill would seriously consider an override, because number one, if I hate to put it this way and sound bad about it, but if the governor's bill doesn't pass, for example, and the override doesn't happen, the worst case scenario, we could see a government shutdown in October, and that's the wrong message to send to the people of Guam.
Wow.
We need to keep the government running. Got to keep the services moving, and continue to protect the people of Guam. So my message is number one: either pass the governors or override the bill. And I'm in support of the override, Chris. So I'm in support of the override. That's the conservative budget. And if there's more, if there's money next month in October that comes in, we will not hesitate to introduce an appropriation to supplement and give the agencies that need the money without any holdback. That would be the easy one. But if you can't see it yet, how do you project something that doesn't even look too nice today? I mean, even today, the Office of Finance and Budget, my office, said that the projection right now is that we're not tracking on special funds coming in. General fund may be coming in and it looks good, but special funds not. And who backs special funds? General fund. So it don't look good right now. And if it looks good next month, then so be it. Then we'll move from there and we'll shift that money there.
Okay,
Where
Senator.
it needs to go. GMH, public health, public safety, education, and we move from there.
Thank you.
All right. Thanks a lot, Senator.
All right. Take care.
Good
ya.
luck today.
Yeah, wash your hands.
Oh, yes. Thank you.
Bring
All
your
right, and
boxing
I'll
gloves.
send you that report.
Okay. See ya. Budget Finance Chair, Senator Joe San Agustin. Sounds like he woke up on the wrong side of the